ask your question, please write it down and someone will get back to you. And I know sometimes it's good to be able to ask it in front of the group, but we may not get to everyone. But we've got someone in the back here first. Thank you.
I want to thank you for having us. There's a bit of a preamble to my question. In my opinion, this province is unfortunately violating laws and acts that run our society. Mandates are not law according to Black's Law Dictionary. They are merely recommendations. There are violations of the Personal Health Information Act, the Canadian Charter of Rights, Section 7, the Canadian Bill of Rights, the Canadian Genetic Non-Discrimination Act by force testing employees, and the Nova Scotia Human Rights Act in regards to discrimination based on a protected characteristic, which is an irrational fear of contracting an illness or disease. A Nova Scotia FOIPOP, or Freedom of Information request listed at shelleyhipson.ca, states that there have been 0 cases of asymptomatic spread in the province. Therefore, if someone is not presenting symptoms, they should not be treated as though they are carrying an illness. If citizens are not able to return to their professions in healthcare based on their private health decisions, that is discrimination. I assume that is why the rest of Canada has permitted unvaccinated employees to return to work, aside from Nova Scotia and British Columbia. So my question is, why is there no accountability in regards to these violations, and why are we not hiring back unvaccinated healthcare workers, especially given the data we have now that suggests the poor efficacy of the vaccines, the many adverse reactions, and the fact that they do not prevent spread of COVID-19? I have heard you state in previous conferences that there are only a little over 100 unvaccinated healthcare workers. I don't believe that this number is accurate and does not reflect the actual number, as many citizens that I know have left work without providing their health information. I know there would be more interest in citizens getting into healthcare if there were no more mandates, and I think the fact that this could save many lives should be taken more seriously. Thank you.
Thank you. Thank you for your comment. And actually, that is a comment that we've heard pretty much at 15 other sessions. So all I would say is I appreciate where you're coming from. We always look, but at this moment in time, that's our policy and we're sticking to it. So I will just take it under advisement and go from there.
Thank you. And I think we had, did you have a question still? Or is it the same? Yeah.